So today I'm going to talk about Initiative 27. Initiative 27 is a bill proposed by the uh, officials of King County that they are going to use taxpayer money to allow for safe injection sites. Now, what safe injection sites stands for, if many people don't know, safe injection sites allow for people to come into specific areas and safely inject themselves with narcotics such as heroin or any other types of drugs that can be directly shot into your veins. And at these clinics, they will be providing new needles, health care if the users need it. They also have the antidote for heroin overdoses. And so safe injection sites are mainly aimed at heroin. So today I'm going to argue against that for many reasons. So personally, I truly believe that there needs to be a plan in place that helps individuals suffer from addiction. So I'm not against trying to come up with specific plans to help addicts. I'm just against letting them shoot up with illegal substances at will without the risk of any punishment. I also agree with the overall intent to try and help them, provide professional care for them, but I have many moral standards that I'm going to talk about today. Personally, I've had personal experience where I've run into drug users, and it was a very negative experience. I also believe that addiction involves more than just having mental health care, counseling, due to the physiological signs. And the Initiative 27 was also struck down by a Seattle judge and was a unanimous vote against it in the Bellevue court, who are all in King County. So first, let me tell you about my personal story. So this summer, I worked downtown, and I often found myself walking downtown around the hours of 6 a.m., 6:30 in order to get to work and open up the place where I was working. There have been many occasions where I was walking in just downtown, usually Westlake Center, and I ran into many people who were using drugs. They asked for money. Instead, I was eating like a protein bar, something just to eat for breakfast, and I offered it to them. And they ended up throwing it back in my face and just laughed at me, saying that they only wanted money, which I assumed they were using for drugs. And I've also personally seen people shooting up in public places, like early in the morning before 7 a.m. when they're forced to move from downtown areas in front of businesses. It's a very gruesome sight. And so personally, I feel like this contradicts Initiative 27 contradicts many of Seattle's policies, state and federal laws, in which I morally cannot support enabling my taxpayer money to go towards programs such as this. And so recently, the mayor proposed that these safe injection sites will receive $1.4 million worth of taxpayer money in order to build these safe injection sites. Give me 5 minutes. Safe injection sites, and which I personally am not okay with. I believe the ordinance is unlawful and contradicts many policies and laws that we have in place, which the appeal to safe injection sites on the ballot should be struck down and should not be allowed to be appealed against and be put on the next vote as King County residents. This is one of the main reasons why I morally believe that safe injection sites do not help people in need, but there should be other programs that the government should start coming up with that does not allow for people to safely inject themselves with illegal narcotics. So one major viewpoint in support of safe injection sites are that having these safe injection sites will provide a safe place for injection, lowering rates of bloodborne diseases and overdoses. And this will also help people reach out to help fight their addiction. So I would like to argue against that, saying that safe injection sites have mixed results. So according to a recent study by the University of Washington Medical Center, they stated that the majority of drug users are already infected by use of unclean needles, etc. They're already HCV positive, which is hepatitis C, and suffer from HIV based off of syringe exchange, which is already moving at a slowly declining rate. So one of the arguments is having safe injection sites is that they will help take dirty syringes that may have bloodborne pathogens on them out of circulation, therefore taking down the rate of bloodborne diseases. But this study clearly shows that there are already programs in place that the syringe rates are already declining, and so therefore the bloodborne pathogens are also already declining. And then supporters of I-27 state that having safe injection sites will dramatically lower these rates of exposure. And so the study shows that users already suffer from these bloodborne diseases, as I already said, and it's approximately increasing around 3 to 4% every year based off the population, even though there are already other needle replacement policies in place in order to lower this. Heroin usage rates have also continued to increase, and you can see that on a local level as well as a national level. President Trump declared a state of emergency for the opioid crisis, and so according to the Seattle database, last year in 2017 there were 359 overdose deaths with the majority of them relating to heroin. And many of this heroin substances are cut with a drug called fentanyl, which fentanyl is an extremely potent opioid, which is much more addictive, much more powerful than what hospitals use morphine. So it's a more powerful drug, and many times people are buying these illegal substances and they have no idea what the drugs are cut with. Often these drugs are cut with harmful substances that are really bad for your body. And so, as drug users continue to use these drugs, these safe injection sites state that they will have counseling, but then they truly lack the full resources in order to combat addiction. So, as many people know, drugs physically alter your brain structure and chemicals produced to make that drug what it is. So, especially for heroin, when you take heroin and it enters your brain, you have extreme dopamine levels increase. Your neurotransmitter receptors are much more open than they would be normally, and so this leads to a physical change in your brain. So, and when I say physical change in your brain, your brain stops producing chemicals on their own, and then it's called your reward pathway physically changes. So then, therefore, in order to receive gratification for specific events or specific times, you have to use the drugs, and in order to beat addiction, you have to change your reward pathways. And so, by just offering counseling or anything like that, their goals cannot be achieved by moral support and strong will due to the overall physical change, and there needs to be like I would say, rehabilitation centers where people have the resources and they have to be able to have the ability to change on their own and change that part of their brain to make it so that they don't need to use the brain in order to emit these neurotransmitters and feel the normal and the way that most humans feel if they're not addicted to drugs. And going off this, I do not believe that offering counseling is a bad idea. I just think there needs to be stronger policies and different programs that will allow users to seek out help without allowing them to use drugs that are extremely addictive, that are very hard to go off of. Now, this bill was also struck down in Bellevue. The City Council unanimously voted against King County's I-27 due to the fear that it would hurt the local homeless population and the planned homeless shelter for the given area. So their reasonings were, which I'm also in agree with, is that having these safe injection sites, it will attract homeless people who are already attracted to addicted to these drugs, and they'll be using these drugs near the homeless shelter, and they'll completely alter the City of Bellevue's plan to having a shelter where they're able to provide homes for people, jobs, etc., in order to fight the rise of homelessness. Also in Seattle, a judge also ruled against the bill in this city and did not allow it on this February's ballot, as they stated that it was against their moral standards and pretty much against the law allowing people to use drugs, which is a felony. Buying, using, possessing illegal substances such as heroin, crack cocaine, or other prescription drugs. But in conclusion, allowing for safe injection sites may be a very noble cause, which I agree with the overall purpose, with lowering opioid use, drug abuse and therefore overdose deaths is a very noble cause, which I'm also in agree with. But I just am against Initiative 27. I therefore think safe injection sites are against America's moral standards. And I think it'll end up doing more harm than good in our given culture. And there need to be other programs in place that do not allow for illegal activity.